Hi guys, it's Emily Swank here with Autism Assistant, and today we're here for another one of our featured provider interviews. I love doing these because I feel like you just get to see our provider's personality a little bit and learn a little bit more about their practice. So today we're here with Dr. Anna Myers, from Sandbox Therapy Group. Hi, Anna.
Hi,
How are you?
thank you for having me.
Of course, of course. So I'm just going to jump right in. What I would love for you to do is just tell us a little bit about yourself, who you are, kind of about the services that you offer, and the age range and location.
Yeah, so I'm a clinical psychologist and I'm a licensed mental health counselor, and I'm also Washington State approved supervisor, which means I help people that just graduated out of graduate school with their doctorates or their master's degree become fully licensed in the state of Washington. So I supervise them during that path, which is usually 3, 4, 5 years. Um, I co-founded Sandbox Therapy Group with my co-founder Ryan Conley, and he's a speech and language pathologist. And we came together and we co-created Sandbox Therapy Group. And there are 3 things that we do at Sandbox Therapy Group. We provide occupational therapy, we provide speech and language therapy, and we also provide psychological services. And that, under that umbrella, there's multiple things we provide, which is psychological evaluations, commonly called testing or assessments. Autism is the #1 thing we do, ADHD as well, mood disorders like anxiety, depression. We provide applied behavior analysis, ABA therapy, traditional talk therapy, where you sit down and just work through things that are bothering you, and group/social skills group therapy as well. And we do this in the home, in the community, which of course those latter halves are far and few between with COVID, but we're getting creative. And of course, we're complying with CDC recommendations to keep it safe and healthy. And then in office as well, in telehealth.
Okay, so what would be your service area location then if you're doing in-home and that sort of thing?
Yeah, we do the east side of Seattle. So we do Redmond and Monroe are where both of our office locations are. But of course, we branch out in areas outside of that. So a lot of Snohomish County and King County, the area that is Bellevue, Kirkland, Woodinville, Redmond, of course, Bothell. And then when you're getting out to the Monroe, we've got, Monroe, Snohomish. We have Duval out there as well. And then we go down the US 2 corridor. So we go, as far as Gold Bar. So we go down pretty
So
far.
that's a big area that you work with.
Yeah,
And
yeah.
is it primarily pediatric patients?
Yes, we predominantly do birth to about, I would say maybe 12, 13, but we also do the whole lifespan. We've been finding that we're getting a lot of inquiries for people that are on the spectrum and realize we specialize in working with folks on the autism spectrum. And so we're getting sometimes patients that are 60, 70 years old, and they're actually wanting an autism diagnosis because they just want to know. And they've gone their whole life and they've read about it and they just want to learn more about themselves and how to be the best they can be each day. So yeah, we don't stop at at adulthood. We actually keep going, but the vast majority of our services, because we started out wanting just to do pediatrics, and then we found that there was such this need in the community. So we've evolved with the growing needs of our local community.
That's awesome. It can be hard to find adult services of any kind, so that's awesome that you guys are available to do that.
Yeah.
So why are the services that you offer so important to autistic children?
Well, one of the common phrases Ryan and I say is early intervention is the best prevention. So we set the foundation to sort of build from, to give individuals that come in to our doors the best chances of thriving, as a childhood, with the hopes that, they'll become as independent as possible and be well on their way each day. Both today and in the future. And sometimes we have children that stay with us through adolescence and then go right on into adulthood. And so we have some patients that we worked with, since 7 years old, and they're getting ready to be 21. And we're continuing to work with them because their needs have evolved, and so have our services to adapt to, whatever they're going through.
Oh, I love that. That's great.
Yeah.
So parents who are new to this whole process, maybe either just received a diagnosis or trying to get a diagnosis, what does all of this, what should they expect? Kind of what does this process look like for them?
Yeah, I think from us, our particular philosophy is working from multiple disciplines. And what that means is we have the disciplines are occupational therapy, speech therapy, and psychological services. And psychological services is broken down into mental health counseling, assessment, the ABA therapy, right? And so we're all working together collaboratively to give the best whole picture of services that this child needs. So we're trying not to have holes or pockets that aren't filled. And we're working with outside providers as well. So psychiatrists, neurologists, medical physicians, dietitians. We have a lot of children that have encopresis and enuresis, which is where they have pottying challenges. So a lot of times we're working with them. And so we're constantly bouncing ideas off of each other. And what I may not know, someone else may know, and then they pick up on that, and then we fill in the gaps. And that's really the best form of treatment, in my opinion. And again, the philosophy of Sandbox is to just work collaboratively as a team to bridge any gaps we have and to help the children become, and adults become as independent as possible. I would say additionally to that, to answer that question, how to sort of prep someone that's, coming into this newly diagnosed is to just have an understanding that commonly it does get worse before it gets better. And what that means is change is uncomfortable. And we're going from a place of where a lot of times we'll have parents that are just in a state of crisis. They come to us, they don't know what to do, they're confused, they just got this diagnosis, where do we start? And it feels like we're bombarding them with information, but we try to do it as supportively as possible, and just know that it's going to take some time to get where you hope to get to, and we're going to be as supportive as possible while we're getting there. And it just takes time. It doesn't happen overnight.
That's awesome. And I love the collaborative effect you speak of, because not everybody does that. And you can see where things fall through the cracks when different providers aren't communicating. So that's awesome. I love that.
Well, and another thing too, oh, sorry.
Oh, go ahead. Sorry.
Another thing too is I feel like sometimes I feel like this pressure sometimes providers feel when it's just their solo and it's just them to try and help them with speech and help them with occupational therapy needs. And we very much believe in just practicing within our scope. Whatever we've been trained in, that's what we excel at. And so we stick to that. And when we're like, hey, this child's struggling with tying their shoes, I'm a clinical psychologist, I focus on behavior. There's some behavioral components to that. Maybe they're upset when they go to brush their teeth. They're upset when they go to, tie their shoes. I can work on that, but I can't work on if they don't have the fine motor skills, right? So that becomes where an occupational therapist or physical therapist comes in and tells me, oh, we need to work on this and that. And so it's important to be mindful of what our boundaries are. And that's another thing Sandbox excels at, is just being ethical in our practice and doing what we excel at, and then getting in other providers, expert opinions, consultations to fill in the gaps where we just don't know.
No, that makes complete sense. I get that. So what's your inspiration behind doing this, and kind of what got you into it?
Kind of what I said before, which is teamwork. We work collaboratively, all the different disciplines. Creativity. We're a bunch of really creative people. We have a lot of playfulness to our approach, both with children and adults. And the adults love coming to our facility because they just say it brings back their childhood. So we're very playful, we're upbeat, just happy, and we're very passionate about what we do. There's a lot of love that goes into what we do, in dedication. And we don't stop until we feel like, we've answered their question. And if we can't answer it, again, we get that consultation and send them somewhere else or consult. And just overall creating a safe, welcoming environment that the child can thrive in, the adult can thrive in, and the family and the system. And be able to not just do that in therapy, but take that home, right? And be able to do that in all the different areas of their life, back at home, back at school, in the grocery store, wherever they're going in the park. So we want to be able to generalize what we do.
Yeah,
Yeah.
that's great. So what do you think is the most challenging thing about what you do, and then the most rewarding?
Yeah, that's a good question. I would say challenging is probably grief. When you first receive an autism diagnosis, not everyone, but a fair amount of families will just go through a grief process of, okay, I had this idea that my son or daughter was going to be like, this all-star like football player, and that's crushed, and we're like, well, we don't know, you don't, right? But there's just such a sense of despair from so many families we get. And again, I'm not saying everyone, but a fair amount. And it's just, there's so much crying that goes into it, and it's okay to not feel okay. Like, I feel like that's not just for COVID, because I know there's a lot of stress with COVID, but when you receive that diagnosis, there's a lot of grief, and there's a lot of burnout, and there's a lot of turnover in the field. Parents will say, you're our 10th provider, what are you going to do? So sometimes they're jaded because they're like, well, I've been to 10 other therapies around town, how are you going to be different? And so we have to rebuild that trust. So a lot of that that energy that comes into when you first meet someone, that there's just so much like turmoil and upset, that's challenging. But if you create a safe environment and build that trust up, we can do some pretty awesome work. And again, if we can't, we have boundaries, we find someone that will. So I would say that's challenging, the most challenging, the grief. The rewarding would be seeing a child graduate, seeing an adult graduate. Oh, man, the days that went leading up to when you start to see, you're like, oh my gosh, they're doing this on their own. We've worked on this for 6 years. They can finally, brush their teeth on their own. Look at this. This is so amazing. And to see that person be able to graduate on their own and become so independent is just, there's no words for that. You can just feel it inside of you. And that's just so amazing. And the other thing I would say is being able to work as a team is a way of continually educating yourself and being informed and knowing what is the best decision for this patient and seeing your blind spots. I think that's really rewarding too, is, I left graduate school and I'm not continually having the education and the teachers, reminding me. So I am, though, with the providers I work with. So it keeps me in check. So I would say that's probably one of the more rewarding things.
That's awesome. And from a parent standpoint, we love to see the progress and the graduation to new things as well. We love to see that with you. So
Yeah, it's exciting and very fulfilling. So fulfilling.
Oh yeah. So my last question would just be, what is something that parents that are maybe considering working with you, what's something you would like them to know?
Sandbox Therapy Group, I feel we pride ourselves on collaboration, optimism, playfulness, and individualized care. We are not cookie cutter. We individualize all care and continually are calibrating to meet the needs of the patient and to meet the needs of the system we're working with. Because a child might come in and they start developmental preschool and they go to a private school or they go to homeschool, and we're continually adapting. And I feel like we do a really good job of making sure we're, crossing our T's, dotting our I's, and just keeping everything in check, and just calibrating as we go. And our motto is play, create, teach, and learn. So we're very playful. I feel like that's another thing too.
I love that. That's, what kid wouldn't love that? Therapy that's based around.
And adults. Don't forget adults can play too, right?
Yes, 100%. And sometimes we're the ones that need a little lighter atmosphere in our day. So
I agree.
Well, guys, if you are interested in contacting Dr. Anna at Sandbox Therapy Group or just have more questions, you can go to her profile on our website at autismassistant.com, and I will actually put the link in the video description below so you can click straight through and contact her directly. Thank you so much for taking the time to be here today and let people see a little bit more about you.
Thank you. Bye.
Bye.